Right to Care is urging the public to call out healthcare facilities not following guidelines put in place to fight the spread of COVID-19. Some of these guidelines include washing your hands regularly with soap and screening before you enter the building. Well, joining us now to discuss this is Dr. Julia Turner from Right to Care. Dr. Turner, good morning and thank you very much. What has led you to Right to Care to highlight this issue?
I think because there have been a number of hospitals or clinics that have had to close down when we found out that a patient who had coronavirus was there but was seen in the usual manner. Went to the waiting room, got their file, saw the doctor or nurse, and then left. And by this stage, when we then find out they're positive, we now have to contact trace everyone that person came in contact with. We have to clean out the waiting room, those consulting rooms. The healthcare workers weren't necessarily wearing the correct PPE to protect them against the virus. And now the healthcare workers have to go into quarantine and can't work, and it's a complete disaster.
Now,
so we really want to help them.
Yeah. Now, how do you propose a member of the public would deal with such an incident?
So I think people can, in general, just try themselves. If they themselves have a cough, a sore throat, or a fever, or shortness of breath, be aware that you might have coronavirus. Now, don't enter a facility in the normal way, sit next to a million people. Rather try and wear a mask if you can, alert the healthcare facility in advance that you're coming, or try and let them know as soon as you enter that you might be a coronavirus patient.
And what if you get there and you've taken the precautions and you notice that the people who are in the hospital, some of them are not taking the necessary precautions? How do you propose that the member public to highlight that? Should they speak to the management of the hospital?
Yes, I think we would encourage that. At the moment, we're not trying to blame any hospitals, we're trying to, or clinics, we're just trying to help them to prepare better. So yes, I would suggest speaking to some management and asking them about them.
It's a very sensible issue to raise as Right to Care. And just practically, you've mentioned that generally there have been incidents. Has anybody approached you with some challenges of healthcare facilities? You're not calling them out by name, but has there been some that in your knowledge who've not been respecting or complying with the necessary regulations?
Yes, I think there have been, but I wouldn't even necessarily call it complying, because they may not have known. You know, everything is changing so rapidly, so we're just trying to spread the news, get the clinics and hospitals to understand how they can do it and how they can adapt these guidelines for their situations. You know, some clinics only have one room, and they don't have another big tent outside where they can do screening. And it'll be a long time before they get a big tent. So then we have to help them adapt that. How can we put a washing station at the gate, a nurse triaging at the gate, and perhaps people can wait in isolation under some trees if there isn't a big tented area or another section of the hospital or clinic.
Yeah, what I like about what you as Right to Care are highlighting is the fact that it's up to each and every one of us to make sure that we are responsible enough, and that when you arrive at a healthcare facility, you mustn't assume that whatever they are doing is accordingly the right stuff. You need to be really aware and ask why they're not wearing a mask at that particular time. Why don't they have a sanitizer?
Yes, exactly.
Yeah, okay, thank you very much. That's Dr. Julia Turner, Senior Technical Advisor for Right to Care.